Good morning from Geneva and welcome to this session on scaling innovation in the new health economy, where we will discuss how to provide an enabling environment for innovation and entrepreneurship in the in the Asia and Pacific region with its specificities, and at the same time make sure that such reforms enable ultimately better health population as a whole. So this session is taking place in the framework of the 7th UNCTAD World Investment Forum. And by the way, for those of you who are interested in these questions, similar discussions will take place on Thursday, 21st of October at 4:30 p.m. Central European Time, where entrepreneurship in the new health economy in Latin America will be discussed, and on Friday, 22nd, 10 a.m. for Africa. Now, allow me to give the floor to Richard Baldwin, Head of Enterprise Branch, Division on Investment and Enterprise at UNCTAD, for a few welcoming words. Richard, the floor is yours.
Thank you very much, Elena. It's a real pleasure for me to, on behalf of UNCTAD, welcome you all to this session on entrepreneurship in the new health economy. As Jelena already mentioned, we have 3 of these sessions this week. We have also a session on pandemic preparedness, which is about investment in productive capacity in medicines. We have other sessions that touch on this topic. For example, a session on science parks or investment in science parks, which also deals with examples of investments in R&D and healthcare technology. So there's this is a hot topic, obviously, in this year's World Investment Forum, and it's a topic that for UNCTAD is, of course, has always been close to our heart. Of course, after with the pandemic, it's become even more central to all the discussions on investment and enterprise development. We had actually in the World Investment Report this year, which came out in June and which is the basis for many of the discussions at the World Investment Forum, we had a specific section on investment in health, and we launched an investment in health initiative. It is also part of our regular Sustainable Development Goals Investment Trends Monitor, very long phrase there, the SDG Trends Monitor, where we monitor investment in all of the SDG relevant sectors, including health. So you can find a lot of information about this here with us. As I said, it's close to our heart already for a long time, even well before the pandemic, because in 2018, for example, we published together with ASEAN, UNCTAD prepares for the ASEAN Secretariat, the ASEAN Investment Report. And the 2018 edition of that was about investment in the health sector. That was a very interesting report. At the time, international investment, which is of course our bread and butter, in the healthcare sector wasn't that widespread yet, certainly among developing regions, but the ASEAN region was among the exceptions. So there was a significant involvement there already from the private sector and international private investors in the healthcare sector. We looked at that through the lens of the entire healthcare value chain. So we looked at everything starting from R&D to pharmaceuticals to hospital services to medical equipment. It all was analyzed there, and we really saw that there's a huge demand now for private investment and a quite supportive environment on the part of most governments who realize that the healthcare goals of the region cannot be met with public investment alone, right? So the environment for private investment in the healthcare sector was relatively conducive, certainly compared to other regions in the world. Of course, that demand for health services that induces this demand for private investment is due to the demographics, a huge and growing population. It is due to a growing affluence, so ability to pay for private healthcare services, And unfortunately, with populations becoming richer, that also brings a series of new healthcare problems. So the market for these services is bigger, and we clearly saw the opportunities for the healthcare providers and healthcare value chain participants that would bring. Technology was already then a strong growth factor, right? There was a lot of private investment in personalized healthcare, in AI-driven analytics or diagnostics, in remote patient monitoring. There were quite a few areas where technology was important and where a lot of private equity and venture capital was eager to go. Of course, our goal always in the end is to land on the policy framework and policy recommendations to make the environment or the climate for private investment more conducive. So that's what we did in that report, and that will also be a key objective of the session today. What we're aiming for today in this session and in the 2 other sessions on the same topic that will follow is to find out what the landscape for entrepreneurship and enterprise development in the health sector looks like in the region. What are the prospects that you see as operators and practitioners in this sector? And what do you see as important policy developments or policy recommendations that you would make for policymakers in the region to make sure that we promote private investment conducive to offering the best possible health care in the region? So with that, let me conclude. I would just like to thank all of the panelists and speakers that we have in the session, and I would like to thank in particular Futureproofing, who has been an extremely helpful and valuable partner in organizing this event. So thank you very much, and rest for me just to wish you all the success in your discussions now. Thank you very much. Over to you.
Thank you very much, Richard. So I will have the pleasure of moderating this session today. My name is Jelena Milenkovic. I am director at the Geneva Health Forum. The Geneva Health Forum is a platform bringing together actors of global health by organizing a major international conference in Geneva every 2 years, and by facilitating dialogue among different stakeholders, such as actors working in the field, private sector, policymakers, and academics, to try and look for solutions together to global health challenges. So I am very happy to be with you today and honored. So this will be a Davos-style discussion. We will hear the perspective of experts in healthcare in the Asia and Pacific region. And we will try to go from the realities of what is really happening on the ground to trying, as mentioned by Richard, to trying and really draw recommendations for public health, for public policies. So you will have the opportunities to ask questions in the chat box. Please feel free to do so during all the session. At the end of the session, we will have about 10 to 15 minutes, hopefully, to try and answer some of your questions. We will do our best. So allow me now to introduce our eminent panelists. So we have Mr. Farid Bidgoli. Farid Bidgoli joined the Roche in 2017, and he became Thailand's general manager in November 2019, where he's also responsible for Myanmar, Cambodia, and Laos. Prior to joining Roche Thailand, he was the country manager for Roche Iran. Now, Mr. Tony Estrella. So Tony is a futurist and a business strategist in healthcare. As an author and podcast host, Tony envisions the impact of technology, going from artificial intelligence to smart devices, robotics, and data on all healthcare stakeholders. from public health to private industry. He is the host of Futureproofing Healthcare, a series exploring the global innovation of public health and Digital Health Today, and Digital Health Today Asia Pacific Edition, a series analyzing the factors, challenges, and examples of health tech across the Asia and Pacific region. Hello, Tony. Mr. Cole Seruchek. Cole is an investor and entrepreneur with over 20 years of experience founding, investing into, and otherwise supporting entrepreneurial ventures. Cole has founded a diverse range of businesses in his career. He is currently the co-founder and CEO of DocDoc, the world's first patient intelligence company. He is also a managing director of Founders Equity Partners, a direct secondary investment firm. And we have Dr. Amit Verma. Amit is a critical care physician who has practiced for almost 30 years in the United States and Asia. He has been on the founding team of large Asian healthcare companies and has served on the board of various companies around Asia in healthcare delivery, life sciences, medical tech, and consumer healthcare. He currently co-manages Quadria Capital, the largest healthcare-focused private equity firm with almost $2 billion in assets under management. And finally, we have Mr. Ethan Cole. Ethan is the Asia Research Director at GPCA, Global Private Capital Association, where he manages the overall Asia data and leads the production of all Asia-related research reports and presentations. He has a dual role as the head of the Asia headquarters based in Singapore, and as such, Ethan supports GPCA's broader programming and advocacy efforts in the region. So hello, everyone, and welcome. So I think we can jump in now, and let's move to the first question. That is a question for all panelists. So in your view, what healthcare challenges does the Asian Pacific region face that would require innovative, scalable, and sustainable solutions and approaches that will need to be integrated in the healthcare systems? So who would ask? Who would start? Farid, maybe? Would you?
Yeah. Good morning, Helena, and thank you very much for inviting me to the World Investment Forum. I think it'd be quite lazy of me if I just said that APAC has a aging population and therefore comorbidities becomes a huge challenge for APAC. I think you have to really think about each individual market. So, for example, if we look at Japan, Singapore, Korea, and Thailand, they've got aging populations, which does bring a different challenge to other markets such as India. So, for example, if we look at Thailand, where I'm based, then by 2030, a third of the population will be over the age of 65. And therefore, healthcare becomes a huge challenge for the government to provide to that aging population. They will have more non-communicable diseases and healthcare costs will rise. But then you've got to think about the opportunity cost. And the opportunity cost is that by 2040, 4 people will be dependent to 1 worker in Thailand. And we see this in Japan as well. We see this challenge in Japan as well, where we don't have a sustainable workforce. And therefore, you need to really think through, again, what are the different needs of that to make from a healthcare perspective for that sustainable workforce. If you look at India in our region has one of the youngest populations. And therefore, when you're thinking about delivering care or personalized care for those individuals, you might focus more on primary prevention, public health, etc. So you need different strategies. I think fundamentally, when we look across APAC region, one of the biggest challenges I see, though, is a lack of universal healthcare across those markets. And for that, we need to think really through around healthcare financing for those markets. So there are numerous challenges. I would say that you really need to understand the market dynamics and segment the markets.
Thank you. Thank you very much, Farid. Maybe Tony, would you like to go?
Yeah, building on what Farah said, and thank you very much for the invitation to join this panel as well. So building on what Farah said, I think if you acknowledge the differences across the variety of markets, and there's 40 plus countries in the overall APAC region, we go for as far east and west as the region expands, the lack of clinicians to patients is also, I think, an enormous challenge. If we look at countries like the archipelago of Indonesia, where you're spread out across 17,000 islands and a population of 275 million people, or in India or China, where you have billions of people, but very low ratios, especially when you look beyond primary care and start looking at specialists. And how do you actually get access to the cardiologist or the neuropsychologist that you might need? And then when you actually look at care itself, are people getting the best quality of care? And there's different models that can help to try to improve that, where technology can certainly be an enabler to trying to improve quality of care, but it's an enormous challenge. And the last thing I would touch on is, if we look at the macro changes that are happening in healthcare and shifting from a one-size-fits-all model of care to becoming more tailored and personalized, we're now looking at different definitions of what does it mean to provide the right type of intervention to the right person at the right time. And that's one of the things that at Futureproofing Healthcare and our podcast especially, we really touch on is how do we bring people together to have the same discussion with the same terminology so that we can then start problem solving together.
Thank you. Thank you very much, Tony. Now, can I give the floor to Amit, please?
Sure. Let me try and not repeat what's already been. To me, actually, what's been fascinating over the past 18 months has been the levelization of how poorly we've done across the globe. It's got nothing to do with Asia Pac. It's got nothing to do with how rich an economy is or how poor it is. We have failed spectacularly. And we failed because we saw it coming. This is not the first, this is not the last pandemic. We just did not get our act together. I have been on too many forums talking about public-private partnerships. I've been on too many forums, people discussing what the problems are. Unfortunately, it's taken a pandemic to prove that two things are very important. Healthcare is and it's not going to get divergent from economies. And these past 18 months have made it brutally clear. I think the unfortunate part is that what I'm seeing is that the recovery is now again manifesting by who has emerged and who's still emerging. So whether it's vaccine access, it's about getting data out there, it's about democratization of ensuring that we provide care to the boomies. And at the end of the day, we are beginning to see the same disparity that we are seeing otherwise. And my last comment, on which while I leave the floor to the others, is that we are sitting at the cusp of a very large chronic disease epidemic. Unfortunately, over the past 18 months, strokes haven't disappeared, heart disease has not disappeared, cancer has not disappeared. All of these guys are going to come back to us, unfortunately, at much later stages. And again, the disparity across the region is going to come back to haunt us. So if there's one thing that I would suggest to this panel, this forum, and to UNCTAD, is figuring out ways of making sure that we can get the care to who needs it as fast as we can.
Thank you. Thank you very much, Amit. Ethan, please.
Hey, Elena. Thanks for having me today. I think it's hard to bring out more points that have not been discussed by the panelists ahead of me. But I think I just want to point out the fact that there is very strong shortage of specialist manpower here in Asia, right? So just to put some numbers in the context, there's only about 1.3 doctors and 3.2 nurses for every 1,000 people in Asia. which is way not enough. And of course, hospital now need to develop a new eye to look for more skill sets that are actually not as matter as much as before the reform, right? So skills like agility, relationship building, and strategic visions are becoming more important now. So I think these are the only point that I'll add to the panelists before.
Thank you very much, Ethan. And now, Cole, could you give us your perspective, please?
Hey guys, I'll apologize for my unsimilar background, and I'll probably need to apologize up front for my unsimilar perspective on a lot of these things. So, look, I think Elon Musk has called it right. The biggest problem we have in society globally is we don't have enough kids. And globally, the entire societal infrastructure about always having more people is unwinding right in front of us. It's not just Japan. It's not just the United States. It's every country in the world that basically isn't using immigration to steal young people. We're having less kids. We're inverting the pyramid. That has profound implications, not just for healthcare, but for basic monetary theory. And that's just one layer of the level of complications that we're facing. It's a big layer, though. So Southeast Asia is going to have a massive train wreck of problems as you look at healthcare and medical inflation and who pays for it as they begin to age, because medical inflation is totally and completely out of control. You know, the rest that everybody thinks about economic growth, Southeast Asia, emerging middle class. Nobody talks about the fact that the emerging middle class is emerging in every way but access to healthcare, because medical inflation is raising much faster than access to care, much faster, many multiples. And why don't we talk about it? Because in the Asian landscape, societally, the best and brightest, their parents push their kids to become doctors. So the most politically connected people are doctors, and they're protecting their rice bowl. And you have an insurance infrastructure and a payment infrastructure that's so far behind in terms of market discipline that they're just doing cost plus contracts. But let's just leave that there as an example. We have a big problem of lack of universal healthcare, juxtaposed with a complete and utter lack of information analytics needed to put any form of price discipline anywhere in the market to make universal access even remotely applicable. And that's not just in Thailand. That's as true in Hong Kong as it is in Indonesia and everywhere in between. So, but let's take a step back even further and talk about how COVID and the things that have happened in COVID are such a big deal. So globally, we have a lack of academic honesty. We have a group of people that are claiming that they know science and they represent democracy, and yet they don't follow the scientific method. This is a big problem. Societies do not prosper when we don't follow the scientific method. The scientific method's not democratic at all. It's based on experimentation and hypothesis and edit, rinse, repeat. It doesn't matter whose idea it was. It's that the idea had value. And we're moving into a phase where I see so much of this conversation is about what side of the political argument you're on, as opposed to what is the inherent compelling nature of the argument. And can we take that hypothesis and put it through a scientific method and see how it holds up? So I'm actually worried about a variety of these problems, more because we're not having a robust discourse about the scientific method used to identify the problem than we are associated with who brought up the idea in the first place. That will never lead to a good outcome. Do I have anything else to talk about? That's enough. Maybe one last point. One last point. It's the duty of us as citizens, whether we are a citizen of the United Nations, a citizen of planet Earth, or a citizen of whatever country we come from. We are where we are because a lot of great people have helped us get here today. It would be naive to believe that Cole Surchek is more than the sum total of the immense geniuses that I had a chance to read and my loving parents that gave me what we are. And I believe we have a duty to speak our minds honestly and openly and to call out what we see happening because if we don't, it'll only get uglier. Because we're going into a phase of ugliness. Like my company's crushing it, but I'm telling you, we're going into a phase of ugliness because we're not expressing our duty as citizens.
Thank you.
And healthcare is prime example. And now I'll be quiet.
Thank you very much, Cole, for all of these perspectives. Thank you very much to all of you, because this was not an easy question to kick off our discussion. And actually, I have an extra question really for you, Cole, actually, for you, with your perspective as an entrepreneur, because we have seen that innovation was quite central in APAC's response to the pandemic. So, from your perspective as a healthcare entrepreneur, what can we learn from such entrepreneurs and their approaches to tackling big challenges?
So, I think it's really important that we frame entrepreneurship in the right light. So, you look at the UN or the World Bank or any of these other major intergovernmental organizations. You guys have scale. If I can get you to believe in a better approach, you can really do something truly extraordinary with it. You're also saddled with a crazy amount of consensus. That makes it really hard to do anything. So the role of the entrepreneur is to be the tip of the spear to show a better way. The role of the larger institution is to put scale behind the entrepreneur. Like that's really how it works. So I'm sitting out here reinventing insurance in healthcare for Southeast Asia. And I'm doing it because I feel like I have a fundamental obligation to my daughter because of a medical issue that she faced. And because a lot of people gave me a lot of things in life, I believe this idea that to that which much is given, much is expected, right? Call it what you want of my own. You can diagnose me psychologically later, but I believe that. And as a consequence, I'm trying to reinvent insurance because I believe the world needs a better deal. They need better access to care. They need better understanding of the care they're receiving, and they need it more affordably. And that's only going to happen if market forces move into healthcare. So that's where I'm devoting my life. If I start showing some obvious evidence of success, I need groups like the United Nations and the World Bank to get behind me because you have leverage and scale. And that's the whole trick. Big organizations are shackled by consensus. Consensus will always be slow moving, and that's just a function of the nature of consensus. I can run out there on my own a long ways on my own, but ultimately I can't get there alone. So I need to bring other people along. And that is the nature of entrepreneurial partnership with large kind of intergovernmental organizations. You guys need to have a certain capacity to deal with failure. I need to have a certain capacity to deal with consensus. Where we strike that balance right, we win. Where we strike it wrong, you guys become corrupt. I'm out there by myself. And I don't ever scale. And we both fail. This is the difference between the Renaissance and the Dark Ages. I don't mean to speak about it too starkly, but it really is this balance. To the extent that we allow scientific method and individual research, and we focus on collaboration, we win. To the extent that we focus on consensus and what party you're in determining the outcome of the result independent of the scientific method, that's the Dark Ages.
Okay, thank you. Thank you very much, Cole. Now I will have a next question for Tony. Tony, what are your observations on the state of readiness of health systems in APAC for advanced innovations in health?
Good question. And I'd like to build on a comment that Cole made in terms of scale, in terms of when we're talking about readiness for health systems are another entity which provides scale. They're the ones who really are responsible for dealing with public health and the bringing basic levels of standards across the spectrum of what it means from a care pathway, all the way from prevention through interventions and everything in between. And So it's really hard to give an answer about state of readiness without actually pointing out that there needs to be a framework on how we actually objectively measure state of readiness. And universally, there really isn't anything out there that allows us to say, here's how a health system A compares to health system B, and it's adopted and accepted by every organization from the UN to the WHO to individual governments. That would be a nice thing to have, because then we'd be able to have that dialogue and say, here's how we as a health system have dealt with breast cancer versus how we've dealt with diabetes and the wave of chronic disease. So in lieu of that, I'd say that what we have to work with is a variety of different private organizations or public entities and NGOs who are trying to put some level of measurement and accountability around that. And so what are some of the things that would go into that sort of an index? Well, when you introduced me, I said, you introduced me as someone who's working with Futureproofing Healthcare, and they have one such index. And I'm not going to go into that. People can go to the website to go through it. But there's a couple of points that I think are universal to any index. Is you have to understand how strategic and how much planning does a health system have, how good is the infrastructure, how good is the data, what are the services and products that are out there that are available to all citizens. And the surprising thing, bringing it to COVID and what it's really shown us, is that the maturity of a particular health system has very low correlation to its ability to take care of citizens and deal with this pandemic. And we've seen that not just in Asia Pacific, but look at it. Where are the highest number of deaths in the world in terms of health systems? We're looking at the U.S., we're looking at Brazil, and as two of the largest, and they're very different health systems. If we look at Asia Pacific, who had the hardest time in dealing with controlling the status of how many people had to have the vaccine, or how many people have COVID, who's been in lockdown the longest? Well, Melbourne has the unfortunate record of being in lockdown for the most number of days in the year, and it's in one of the most mature health systems. Japan, and during the Olympics, was very iffy as to whether we'd even have that. So I'd say overall, if we can have a system that allows us to objectively measure, and then we can use that to then be able to create the closed loop feedback that works in healthcare. You have data and information that tells you where things are broken. You go in and you fix whatever is broken, and then you continue to have ongoing measurement. Then that's really where we'll be able to apply the right type of innovation, whether it's let's fix the current system or let's move to a new system, because we have that data to be able to help us make those decisions.
Thank you. Thank you very much, Tony. Now, I would have a question for Farid. We have heard that personalized healthcare is really a big challenge in APAC. In your view, how can pharma support healthcare entrepreneurs and innovators succeed in accelerating this shift towards personalized healthcare?
Yeah, thanks, Helena. I think your question's quite leading in the fact that it presumes that actually that pharma has been successful thus far in helping develop personalized healthcare and healthcare systems. That the epitome would be full universal healthcare coverage, and everybody, like Tony said, gets treated with the right treatment at the right time in the right setting, and that's not here yet. I think one of the things that, and it's not just pharma, right? I think if, Amit and Cole might have something to say that only pharma create the right environment. But, we did invest in partnership with the Copenhagen Institute to develop the Personalized Healthcare Index across APAC, which measures 11 countries on different parameters as a policy shaping piece to try and help governments understand where they stood in comparative to others. There's nothing better that governments like to be ranked and forced and competing with each other. It actually does drive change. We can see that. But that was really the first index of its kind on a personalized healthcare perspective to really see where are we now, and to help then have that dialogue within individual markets to say, what do we need to put in place to where do we need to be? From an entrepreneurial perspective, there are many things that I would recommend to entrepreneurs. I would say, you've got to do your homework, you've got to do your research. Not every company is interested in personalized healthcare. At Roche, we make, personalized healthcare part of our DNA. We're specifically strategically important to us. And we invest in it. So we invest in, one of the largest oncology claims databases in the US called Flatiron. We purchased a genomics company called Foundation Medicine. We have a portfolio which is built around genomic mutations, to address genomic mutations in cancer care. And then in our DNA, in every therapeutic area, because we're not arrogant enough to say that actually a medicine is the utopia to managing personalized healthcare, we know that personalized experience of care is important. That drives better outcomes. And therefore, we think about what else that beyond our medicine can we really do to support and enhance patient care. So for example, in neuroscience, we're trying to understand how do neurodegenerative diseases progress over time, and how does that differ from individual to individual. So we're using wearables, or we're using virtual technology to understand visual acuity loss in real time. From that point of view, then we do have enabling platforms, and other companies do have this, right? So I'm not just speaking on behalf of Roche, but we have, for example, Creosphere, startup Creosphere, which is across APAC, it's across Europe, but this is a partnership with Plug and Play, where we invite entrepreneurs to come and solve for some of the call out challenges that we want to address. So, for example, in APAC, women's health, artificial intelligence, we're looking at biosensors, we're looking at oncology. So these are some of the things where we invite entrepreneurs to come and share with us their great ideas, and then we take them on board, we incubate them. As Cole said, we try and give them scale. In fact, in Thailand, we're trying to do that with a ophthalmology company from the UK. We will run a clinical trial here actually in Thailand. And what that company has is it has a visual acuity device. It's actually a VR headset. And basically they approached Roche and they thought that they had a visual aid, to help people see better. But actually what they have is an ability in real time to understand visual acuity loss. And therefore, if we can understand visual acuity loss in real time, we can suggest to patients when they need to go to see the ophthalmologist. We can suggest when they need a dose reduction to a certain medicine. That's personalizing the patient experience. So incubation is also part of the way that we can also help. So we create the platforms, we incubate. But as I say, if you were to look at Philips, for example, Philips also have a similar partnership with 35 other multinationals, I think in 40 different markets, where this specifically focused on AI and AI innovation. And helping use that as a platform for startups. So there are many opportunities for startups there, but I would say to entrepreneurs, you have to do your homework.
Okay, thank you very much, Barry, for that insight. I would have a question for Amit. Amit, given the scale and multitude of challenges post-COVID-19, how would you think can APAC ensure a coherent life science strategy and policy approach to promote investment as an engine of growth, and also ensure that the recovery is inclusive and that its benefits extend to all countries?
I think that's utopian. I don't see an environment where, as Cole started off his comments by saying how divisive we still haven't been able to convince each other to vaccinate. Forget about talking about now bringing a utopian society where everybody looks at each other. To my mind, as an investor, I deal with a slightly different challenge. I have a host of well-meaning companies which are bringing technology to society, but without understanding the fundamentals of what needs to do to scale up. So we see a plethora of great ideas, very few entrepreneurs who understand what it takes to scale up. And our biggest challenge is finding companies that we can invest in, which have the wherewithal to sustain themselves. On the other side, you have the public sector, which again comes in with its monolithic approach, a lot of bureaucracy, and it becomes very hard to build out an ecosystem which makes sense. A third challenge, which is the biggest one, is the insane, and there's no other word for it, insane healthcare valuations that exist in this part of the world. And that's basically because we just don't have enough decent companies of scale, size, ethics, integrity, which are actually investable. So you have a bunch of people who are throwing money at healthcare as if there's no tomorrow. And you have a lot of people who don't understand what it takes to scale healthcare up because of the fact that has a bit more of domain expertise needed, which is harder to do. What I am optimistic about is that over the past couple of years, and I've been around in this environment now for more than a decade, earlier there used to be this great public-private divide. The public guys would always believe the private guys are out to fleece you. The private guys would always believe that the public guys don't know what they're talking about. I think for the first time, I'm beginning to see a meaningful dialogue on how all of us need to work together. Because it's, as I mentioned earlier, it's quite clear that we can't deal with it individually. So to me, if you ask me, healthcare is probably a fundamental right. We, APAC, have to get our act together. The funding cannot come from just one source. I do not know of any government in this region who can fund healthcare the way it should be. So the private health sector will have to play a meaningful role to make this happen. What platform, maybe the UNCTADs of the world, can help in at least starting meaningful dialogue? And then the onus is on us to figure out ways of working with each other without undercutting. So hopefully, post-COVID, I hope that we don't forget what we've gone through and actually use this as a launch pad to start off a more meaningful strategic dialogue on how to improve the lives of the masses of people all around us.
Thank you very much, Amit. Now, Ethan, could you give us your perspectives on what are the key constraints preventing investment in fast developing technologies in healthcare?
Thanks, Elena. Yeah, I think even before the pandemic, there is already rising interest in fast developing technologies in healthcare, which is digital health, right? What pandemic does is it really accelerated the increase in the uptake of the digital health solutions. Now we are actually seeing services such as digital medicine become a much rational, needed alternative during this period of time. However, we think that there are multiple factors that need to play out for these digital health solutions to be considered long-term prospects for investments. So for example, if you ask me, there are still cultural preferences towards face-to-face consultations instead of using telemedicine. There are lack of standardized rules and regulations, and of course, having a sustainable economic and payer model for such of digital health. I think despite this strong uptake of digital health led by the pandemic, these startup companies need to be cracking the right model, and finding monetization pathway will be very, very important. Digital health startup needs to demonstrate effectiveness and market opportunity beyond pilots, managing sales cycles, and of course, sustain to be able to strive in this future. Maybe just one more point. I think there will be increased competition as well in this space by existing healthcare service providers, as who are actually seeing digital health as a natural extension to their service offering. They already have their network infrastructure and know-how. So more competition in that space as well.
Thank you very much, Ethan. Now, Cole, what is the role in your view of health innovators and startups in the current evolving healthcare ecosystem in the region?
So, I can't emphasize this point enough. When you move away from first principled thinking, you move away from the capacity of the human being to maximize well-being. So what Amit is saying is right about valuation from one perspective. But if Amit tried to build a couple of these companies, he'd realize how unbelievably difficult they are. And to even get any traction, what it actually means. And then he'd go, wow, there were some brilliant people that spent 5 or 7 years just to get to that traction point. And as a consequence, they have to be compensated because they could have made millions of dollars doing a variety of anything. So it's a difficult dance. and I don't want to pretend like I have an answer, short of some kind of key unifying principles. You got to start with first principle thinking. Medical inflation in APAC is somewhere between 3 and 5 times GDP growth. Okay? And it was radically underserved before that happened. That cannot continue. It's a recipe for absolute societal disruption. Cannot continue, will not continue. The startups have to start figuring out how to instill price discipline and quality metrics in healthcare. Like, as much as we want to pretend it's all equal and it's all this, let's all get together and hold hands, it's not. Healthcare is zero sum. The price we're paying, someone's benefiting from the care they're delivering. Right? There's plenty of money being spent. There's not plenty of care being delivered. Why? Because the price of the care is increasing much faster than the quality of the care, the technological innovation associated with that care. Why is that happening? Because no one's looking at the bill. It's at the end of the day, that's it. The way in which we consume healthcare in Asia, let me give you a buying a car analogy, because this is the easiest way to put first principled care to work. Imagine you walked into an auto dealership and you put down your black American Express Centurion card. So there's no limit on that card. You don't know if you get a Rolls-Royce Phantom and you pay for a Daihatsu Charade, or you pay for a Daihatsu Charade and get a Rolls-Royce Phantom. You just hand the auto dealer your card and hope it all works out. That's modern APEC healthcare, full stop. That's never going to work. That's never going to work from the pharma point of view. It's never going to work from the device point of view. It's never going to work. It's never going to work. And yet that's the level of information transparency and price discipline we have. And then we call it a capitalist system. That's not a capitalist system. There's no information exchange. There's no price transparency. So the government either needs to nationalize and come in and take it over like a Germany or a Australia or a totally nationalized system, or they have to instill true price discipline through information exchange. But pretending that APEC has that is just a misdiagnosis of where we sit today.
Okay, thank you. Thank you, Cole. I have a next question for Tony with your broad perspective. What shifts do you think would need to take place to ensure that healthcare ecosystem stakeholders, including healthcare professionals, academics, and researchers, can embrace a more agile and entrepreneurial mindset and smart risk-taking? Here some balance needs to be found, of course. We can look for agility, definitely we have to, but at the same time, healthcare systems needs to be stable, equitable, and affordable. So what are your views on this, Tony?
Look, I think we can all acknowledge and agree that behavior change is hard, and changing people's minds to act in a different way is probably going to be the hardest challenge that has to exist, whether we're talking healthcare or otherwise. And that applies, I think, to the notion of how do we encourage people to be more entrepreneurial and be risk takers. And I'll give three examples here that help to bring to light, I think, is an important shift. First is when we look at providers and clinical proof points. The group of us here in this panel and many of our probably first and second degree connections are probably all very bought into the need for evidence. But when you look down a layer and you look at what does it take in the clinical context to be able to get a new solution, new idea, a new treatment validated by peers, the system is broken, because to have peers implies that everybody's already bought into the idea. And this is something that I didn't make up. It's something that I had a conversation with Rhoda Oh, who's a woman at Boston University who's responsible for the Framingham study. And we talked at length about this challenge, about you can't be first in the clinical context because you're constantly having to come up against brick walls. So it's better to be 10th. And that just doesn't work if we're trying to get a change in mindset and a change in the way that people operate from a clinical point of view. A second point I would say is around payer innovation and pricing and budgets. I think Cole brought up the notion of who's looking at the bill. And I think that, whether we're talking about health systems or private insurers, there is definitely inefficiencies that need to be solved there. And if you try to introduce something new and innovative, the first reaction that you will get from a lot of people who are responsible for managing budgets is too expensive. Well, too expensive is relative to what? And I think the car analogy is actually a good one for this point as well, where if you buy a Tesla and you look at total cost of ownership for an electric vehicle relative to total cost of ownership for my petrol guzzling car and how much petrol I buy over a 10-year period, well, the electric vehicle comes out better. And so you have to look at total costs of an intervention or overall care when you try to make this decision about budgets, because if you look at it at a point in time, of course, new and innovative is always going to look more expensive. And that's just the challenge. So thinking about things in the context of total cost of ownership, or how do I shift costs? So if I prevent 10% of people from ever becoming diabetics, and I no longer have that system cost to manage, and I then apply the savings from that towards new initiatives, well, my total costs I might have spent over a 5-10 year period are actually less, but I now was able to offer something more innovative. And last point I would make is around precision. Precision is very commonly used when we're talking about precision medicine, better interventions. We might be talking about better precision when it comes to diagnostics as well, diagnosing earlier. But I think there needs to be more emphasis placed on precision communication as well. And I think that when we speak to people when they're in the right mindset to receive messages to say, be more entrepreneurial, be a risk taker, but it's put in a context of this actually fits into your remit. Here's information that helps you manage against your remit at whatever role you might have. And you're actually continuing to do the right thing, but now you can just apply a new type of tool, new type of service, but still keep things in a relative stable way, whether it's process or cost or whatnot. That's where precision communication fits in. And we've seen it fall apart when it comes to targeting people who are vaccinated with unvaccinated messages, as one example. So those are just some things that I think that need to be put into place in shifting our mindset and trying to decide how do we shift others' mindset.
Mm-hmm. Thank you very much, Tony. Now my next question goes for Farid. You know very well Thailand. Could you maybe share with us some examples of initiatives that represent good practices, personalized healthcare? You know very well Thailand. How can it compare? What would other countries need to do in order to enable this digitalized future of health?
Yeah, so leaning on the Futureproofing Healthcare Index, then out of 11 countries, quite interestingly, Thailand ranked joint number one with Taiwan for having the best personalized healthcare strategy, number one. But overall, they ranked number 7th. So quite interestingly, we talk about, can you talk the talk and can you walk the walk? So Thailand is a country that, from a personalized healthcare perspective, is talking the talk. But the countries that were walking the walk were Singapore. Yeah. And, if we were to look at Singapore, for example, then, they have great data infrastructure. They have the Beyond Healthcare program, which is beyond, value, what Tony was talking to. They have Beyond Hospital to Community, so trying to personalize experience. So that they really did invest specifically in their strategy. They have the genomic 100,000 genomes project. Thailand has a 50,000 genome project yet to really be implemented. Yeah, still struggling for procurement of who should provide that level of service. So, it really is about who is walking the walk in personalized healthcare. I think the great thing is there is good energy in APAC for personalized healthcare. Irrespective of what market we looked at, there was good energy and there was great examples. So, for example, you asked for examples, and if I take you to Cambodia, in Cambodia on Tom Sam Lake, they have a small rural fishing community. The challenge there is that doctors would get on boats with electronic healthcare, with paper records, try and see individuals there, and then the records would get wet. It obviously rains a lot and get destroyed. They would just lose all that information. So a small startup in Cambodia worked with the government and develops electronic healthcare records and used 3G spot connectivity to basically correct the first EHR record in Cambodia. Now, very simple. You're probably thinking, why is that a big deal? It's a big deal because in Cambodia, we don't have electronic healthcare records. Now, why is Cambodia not adopting what they did for a community on a lake and scaling it to the rest of the country? That's the question. That's what government should be doing. If we look at Laos, Laos has a big problem when it comes to tuberculosis. About 3,500 people die every year in Laos from TB. They partnered with a Japanese company to use AI and imaging of chest X-rays, and we're able to really, with high accuracy, test people for TB. Again, great. Who would think that a 7 million population in Laos are doing things like that? They are. So personalized healthcare is everywhere. Now, in Thailand, I can talk to you about genomic medicine. And in Thailand, from a private spectrum, and we talk about health and equity in the private sector, and the people that can afford healthcare, then we have really great personalized healthcare. People can have, their tissue genomically biomarkered, and then given a guided consultation. The physician can treat them with the right medicine at the right time in the right setting. Unfortunately, that's not universal yet. And, we started to partner now with Siriraj and Chula to try and help provide that level of infrastructure to bring down the cost, to broaden access, availability. When I think about personalized healthcare, though, I can talk a lot about genomics because I work for a pharmaceutical company that has a vested interest, but I like to think about personalized experience of care. There's a company in Thailand in the southern provinces where there's not a lot of industry at all. There's a small startup called Welelia, and they take a buccal sample, and they genetically test that buccal sample, and they give people dietary advice based on that genetic swab. And they partnered with 40 restaurants across Thailand where you can share your information with the chefs, and they will provide you with food that suit your gut biome. Now, that's personalized, that's connected to industry, that's bringing other players in place. So there's some great examples. The other example I really like in Thailand is Siriraj. Siriraj is one of the largest hospitals. It's university hospitals, one of the largest providers in whole of Southeast Asia. They have what they call Siriraj Connect. Essentially, they have a telehealth service, and they have you can book appointments online. You can book appointments on their app. If your clinic is running late, if your appointment's running late, they notify you and they signpost you to the nearest coffee shop. If you are having a telehealth consultation via Siriraj, all of the operators have a mirror next to their computer. Now, why do they have a mirror next to their computer? It's because they want the operators to check their facial expressions and to see, are they being genuinely interested in the individual they're talking to? Are they happy? Or how they're feeling? To check their own mood, because we want to deliver a great experience. That is a personalized experience. So I think when you start looking across a personalized healthcare index, you can look at personalized health policies, you can look at personalized access to personalized technologies. But in general, I would say there's great energy in this space and some great examples across all of the APAC region.
Thank you. Thank you very much, Barry. That's already quite encouraging. Now a question for Amit. How do you think can venture capitals ensure a diverse set of perspectives in order to enable innovation to thrive, particularly in the emerging markets?
That question is deceptively hard. At the end of the day, I think it's about listening and it's about enabling. And as Cole had mentioned earlier, it's about also respecting the work that goes behind in creating successful companies. I think our job as venture or PE guys is to be able to understand the problem, B, understand how the company is solving it, and see how we can add value. Value creation is probably the most abused word in private equity. Every private equity entrepreneur believes that they are out there and they'll come in and solve the problems without taking into account that a lot of times we probably won't know how to improve it. I think our approach is slightly different. Our approach is all about ensuring that you are backing good quality companies. Most importantly, you're backing good quality people. And as we do our diligence, we try and figure out how we could actually contribute. So there could be maybe one thing that I could bring to the table, 3 or 4 of those deficiencies. And our job then is to try and put our hand up and say, guys, apart from the money that we bring to the table, why don't we try and help you solve this problem? To me, there are not enough of us doing that. There are not enough of us guys who are trying to help, but we are bringing our own dogmas and doctrines into the way businesses are run. The APAC and any part of the emerging world comes with its own complications. It's not a one size fits all. Just because it's worked in one part of the world is not going to make it work here. And it needs to then be modified and made sure that we can actually provide a local solution. At the end of the day, let's remember, healthcare is, we can bring in the layers of technology, we can bring in the layers of SOPs, we can bring in the layers of what has worked in the past should work again, but it still boils down to how we approach our customers or patients locally. And to my mind, if there's one thing that I would suggest that we bring in to the table is listen. Be very clear that we're out to help solve the problem. We are not the sole proprietors of problem solving.
Thank you very much, Amit. So my next question goes for Ethan. How do you think can APAC ecosystems enable greater flows of private capital to be deployed to promising health innovators?
Thank you, Elena. I think we are already seeing greater flow of private capital deployment into health innovators, health tech companies in Asia. Right, at GPCA, we did record about $3 billion USD of investments into health tech by private capital in our mid-year 2021 data. So this figure is already on par with the full year figures in 2020. However, if you look more into the data, you realize that everything is more of a VC play right now in Asia. Over 60 deals made in the first half of 2021, only 4 of them are PE-backed deals. The rest of them are early-stage venture capital deals. So I think the question is here, in order to enable greater flow of private capital into health tech, how do we tap PE firms to deploy to health tech when it matures? So I think Amit did provide some of his perspective as a PE investor just now, based on some of the conversations we have from GPCA members, that some of the private equity firms that traditionally invest into healthcare companies are now warming up to the ideas of making investments in health tech firms too. So I think at the moment, it's a little bit of a wait and watch thing to see these firms in the health tech space can have the scalability, user adoption, engagement, and of course, generate sustainable profits. Maybe just one last thing, health tech, I feel, will continue to be an attractive opportunity in Asia, growing policies to foster innovation. There is a need for more cost-efficient health services considering the growing elderly population, and of course, a larger prevalence of chronic diseases and supported by the rising digital maturity in the region. But then this opportunity don't come without risk, right? There's evolving fragmented regulatory policies and of course, more stringent data policy laws coming into play. So I think all operators within the ecosystem needs to be agile and open to collaboration. Thank you.
Thank you. Thank you very much, Ethan. Now we're coming to a question aiming at, as we said, drawing some recommendations, and it goes to all our panelists. So in your view, how can governmental institutions and policy support the enablement of these innovations? What structural frameworks would need to be put in place to keep pace with innovation? Who would like to go first? Seeing Amit. Amit, would you like to go first?
Sure. I mean, at the end of the day, we need to look at, and we've discussed this and debated this a lot, how we can make the system smarter, how can we bring innovations to the table. I think the diverse panel over here has brought its own ideas on what we can do to make it better. I don't think I have any great suggestions on this particular question on how to answer it, but my view, it's about an ecosystem and creating that and ensuring that we're listening to each other to make it happen. Quite clearly, there's a lot of research out there. There's a lot of scientific bias, which is making sense. We would probably need to bring those together on a platform where the communication styles need to get better and we can help transmit knowledge. I think one of the points that I do want to bring to fore, and I think Cole mentioned that right at the beginning, is the lack of tangible, reproducible data in this part of the world. And that's something that we don't have. There are no platforms by which we share. We all live in our own little silos. My most common example is that if I were to turn around and say how many diabetics in Asia Pac, it could go from, your answer could be 50 million, I could say 500 million. Guess what? Both of us could be right. We have no clue. Nobody's actually done any of these. To me, one of the changes that I do see going forward is the ability for data analytics in healthcare actually becoming, and without knowing what we're trying to treat and the enormity of issues, I think we're going to end up with a lot more Band-Aid type solutions. Probably the other guys on the panel can take a shot at this, but to me, digital analytics and the fact that we don't have reproducible healthcare analytics is a massive issue.
Thank you. Thank you very much, Amit. Farid, would you like to go?
Yes, so this is a subject actually I'm quite passionate about because it frustrates me. Just working for an innovative-based company who tries to get innovation in healthcare. You know, if we struggle as pharma, then I feel sorry for the startup trying to do the same thing. Building on what Amit says, right? The healthcare systems to become sustainable need to be powered by data, right? It's a fundamental requirement. I remember when I first started off driving, my first car was a VW Beetle. I had so many problems with that car. By the end of the time, I used to be a mechanic, right? Then my second car, I used to have to take to the garage. I didn't know how to fix it. It was a bit more complex. And the mechanic would say to me, it could be the carburetor, it could be the turbo. The diagnostic wasn't clear, right? And I was thinking, is this guy trying to make money off me? Is he trying to rip me off? Today, most cars, diagnose themselves, tell you when you need to go and take them to the garage. The mechanic puts them to a machine and it tells the mechanics exactly what is wrong with the car, right? BMW, Mercedes, Tesla, Nissan, Toyota, they've got better diagnostic infrastructure of their fleet population than healthcare systems do on their own population, because they are powered by data, bioinformatics. If we use bioinformatics and we used, biometrics, and we used, GPS, and we used electronic healthcare records, and we used AI, we'd be able to call in a patient at the right time when we feel that they're going to get into trouble. We'd be able to really understand disease far more granular, without having governments really understand that actually electronic healthcare records, connectivity, data interoperability, data standards are the basic foundations of a healthcare system in the 21st century. We're not going anywhere, whether it be in APAC or the rest of the world or LATAM or South Africa. So data is an essential part for me to make sure that we have that correctly. The second thing then is around access. And you asked me a question before, Helena, and a few of the other panelists around, how do you enable startups? How do you enable entrepreneurs? How do you incubate them on it? What do you need to do for them to be successful? I wish we had, a governmental representative or a payer from a healthcare institution on this policy, and you ask them the same question. because they also have an enabling role to adopt technology. If they don't adopt technology or create the environments, then we'll never have innovation at scale and at mass. And, we talk about evidence generation. Tony touched on evidence generation as being a part and point of, developing innovation and bringing them to market. We spend billions on clinical trials to provide evidence our innovations are safe and effective for healthcare and should be invested in and are worth the money. That doesn't mean they get adopted, at all. And, the startup company that doesn't really have that clinical trial mindset or that foresight to say, what am I going to have to prove? What story am I going to have to tell? And what data points am I going to have to generate for my business in healthcare at the beginning, but has a great idea, fails. And therefore, the incubation period in healthcare is really important, that we take the risks and we say, okay, listen, try it. If it works, we'll scale, we'll pay for it. Yeah. And the National Healthcare Service in 2017 in the UK actually did this. They run what they called a testbed program. And they brought innovative companies together to try and solve some of the biggest healthcare challenges. They asked companies, come and bring your innovation for free of charge, but we'll collect data. And if it works, we'll scale. And that's a part of, a healthcare system really thinking about wanting to adopt innovation moving forward. You talk about policies and frameworks. When I sit down with governments and I ask them around, I complain how much I'm investing in terms of clinical trial development, in terms of staffing costs, how much we contribute to the economy. And they say, okay, well, what do you want to build a big manufacturing site here? We can offer you really great tax breaks. I say to them, I don't want tax breaks. I want access to our innovation to people because that makes a meaningful difference. A tax break might make the shareholders of pharmaceutical companies a little bit happier, but actually what makes them really happy is when the innovation is being used at scale and making a meaningful difference to society. And therefore I say, well, actually, if we have access frameworks, if we have scalability, if we can have a dialogue around how we make these innovations accessible to your population, then that's the true policy framework that I would advocate for. So those are just, I guess, some of the things that, this is a topic I'm quite passionate about, but data is data has to be the future. And if we don't use that, then healthcare will become expensive, as Cole said. It'll become more increasingly expensive. We need data infrastructure. We need to make sure that healthcare systems are enabling the adoption of innovation, both big and small, companies, and making sure they enable it. And then thirdly, that the incentive has to be access. The incentive has to be uptake of the innovation in healthcare.
Thank you very much, Farid. Tony?
Building on the points that Amit and Farid said, I'm 100%, I personally believe that data is a big part of how do we get to this place where change is enabled. I also want to bring it back to the fact that institutions are ultimately managed and driven by people. And the people who are in those institutions are the ones who really have the ability to influence and change, whether we have tech platforms and data that then accelerate improving health outcomes. And so the question in my mind in thinking about this is it possible to infuse a different way of thinking that enhances or unlocks the talent of people who are already in these organizations? Because it would be nearly impossible to say, let's swap the whole thing out and let's start over. I don't think that it has any realistic nature behind it. But can we create something to unlock talent? And it reminds me of a story of what happened in the US about 20 years ago. Entrepreneur by the name of Todd Park, during the beginning of Obama administration, came into Health and Human Services and became CTO of Health and Human Services. And Todd Park was a well-known entrepreneur, built a company called Athena Health, and his contribution to helping to unlock people's creativity was the development of the blue button. So essentially what it was your health data is yours. That was his general premise. And his goal was to work across the organization to say, let's unlock that data so it can be used by the individuals who own it and give their permission to be used by other organizations who can aggregate, anonymize, and use that data to be able to improve health. And the product marketing component of it was to call it the blue button, and there was a whole set of things that everyone can Google it and find out more. The reason I'm telling that story, though, is that the people didn't change, but the mechanisms and the frameworks by who was able to raise their hands to say, I want to work in a different way, was unlocked by one individual. So I think first and foremost, being able to have the right type of people coming in to help shape or change mindsets is one step. I think also second thing is if we look at COVID and what it's done, is it's really broken what people might have perceived to say, these are barriers I will never be willing to cross as a governmental institution or policymaker. And India is a good example around that, where prior to COVID, telemedicine was illegal. And now it's not. And we can all see the results of what it's meant to, large public hospitals, to small private hospitals like Ujala Cygnus, which has 12 hospitals dealing with rural populations in India. And the last point I'll make when it comes to people is our future leaders. So we can't do much in terms of staffing and changing the existing organizations, because that has organic way of growing, but we can prepare better future leaders. And I spoke to an entrepreneur who named Dale Sanders in the US, who's been very experienced in helping to think through large scale technology problems. And our conversation led to the fact that future health leaders should be cross-trained. We should not necessarily only be hiring people who've gone to public health schools and gotten degrees. We should be hiring engineers. We should be hiring people who are classically trained musicians. We should be looking at people who have different mindsets that are willing to apply themselves into this structure and construct to be able to bring creativity to solving these problems that are immensely complex, but apply different thinking to be able to overcome them.
Thank you. Thank you very much. Eden?
Yes. I think I only have a very short reply. I think the best thing that a government institute or policymakers can do to enable innovation is to do your best to create a dynamic ecosystems, right? Where you can have access to talent, capital, and of course expertise to enable these groups to be able to meet up and pilot, scale digital healthcare and wellness solutions for Asia. So that dynamic ecosystem is very important, and government should lead the way in creating it.
Thank you. Thank you very much, Ethan. So one last word from Cole before we go to the questions from the public. Cole?
What specifically are you asking? How to innovate?
No, what do you think should governmental institutions and policy do in order to support innovation?
So, all right. This is an uncomfortable truth about healthcare. It's a zero-sum game. So an individual starts healthy, they get sick. They don't want to be sick. They want to get solved. But every dollar that they pay for being sick goes somewhere. Every dollar that the government puts in, look at the National Institute of Health. All you have to do to understand the pharmaceutical industry, in a nutshell, is look at their return on invested capital. It's the highest in the world, and it has been for a very long time. Why is that possible? It's possible because of barriers to entry. It's possible because of government grants that do the bulk of the really hard R&D and let them cherry pick, right? So healthcare is zero sum. That's the reality of it. We all start healthy, we get sick, we want to get healthy as quickly as we can. The longer we stay sick, the more people value in the system, whether that's device, whether that's insurance, whether that's pharmaceuticals, whether that's hospitals. So what you want as a government policy initiative, you want to maximize innovation, and you want as much transparency and price discipline as you can possibly put in the system. What do all the players want? The opposite of that. I mean, I hate to say that, but that's the truth. They want the exact opposite. They want the government to fund as much basic innovation and basic research as possible, take all the really big risk. When the moment it looks like it's growth equity, they want to step in and act like the good guys and fund it for phase 2, phase 3 trials. That's true in my wife used to run Medtronic Asia. So whether that's true in devices, that's true in pharma. What do the insurance guys want? They want cost plus contracts. This is the way the system unfortunately operates today. The regulators have got to take a step back and say, how do we reinvent this infrastructure? Because it's radically broken. The United States spends close to 19% of its GDP on healthcare, and they still can't make it work with universal access. Right? There's no end to the amount of money you can pay a for-profit seeking corporation. So you have to put in place transparent information and competition at every single level, or you have to straight up nationalize it. You look at what Germany's done. It's a great system. You look at what the UK's done. It's a good system. You look at what Australia's done. It's a pretty good system. Canada's a pretty good system. That's government, right? That's one approach. You look at the US, 20% of the world's pharmaceuticals are consumed there. 80% of the profits made there. How does that make any sense? It doesn't. It's unsustainable. APEC's got to make a decision. They got to make a choice about kind of how they innovate. And the government's kind of got to step in and say, okay, we're either going to massively increase information to promote competition and price transparency, or we're going to straight up nationalize price control. Either side is rational, but one side is required. And APEC hasn't taken a side one way or the other. And the net result is massive uncontrolled medical inflation in the context of a population that's young and rapidly aging. That's about all.
I'd like to just maybe just offer a different perspective to
Sure.
Cole's hypothesis that actually healthcare inflation is driven by industry or by innovation or by big pharma. You know, you mentioned the National Healthcare Service. National Healthcare Service in the UK is the largest provider of healthcare, of universal coverage. Yeah, 10 to 12% of the total expenditure, 110 billion, actually goes on pharmaceuticals or device. Only 10 to 12%. The rest is actually in infrastructure. The rest is in buildings, it's in estates, it's in personnel. Now, when Ethan talks about, you know, the challenges in APAC in terms of, do we have the workforce to manage the healthcare tide, the healthcare burden and the tide that's coming our way? You know, that's when we have to look to innovation. We have to look towards telehealth, telemedicine. We have to look towards data to keep our population healthier for longer. Yeah, so we have to reimagine how healthcare is delivered. Yeah, unfortunately, if you were to go to Cambodia, Laos, just let me finish, Cole. If we go to Cambodia or Laos now, or Myanmar, they're building hospitals.
Yes.
Why build hospitals? You don't need to build infrastructure. Yeah, you can have digital consultation. You can have diagnostics done virtually. So we need to fully reimagine how healthcare is delivered across APAC. Not this incremental change or follow what's done before, because that won't really deliver better healthcare. If we reimagine healthcare in a digital age, then we'll be able to deliver healthcare more personalized. We'll be able to deliver better patient outcomes, and we'll be able to do it at a lower cost per capita.
So that's cute. It's not wrong. It's not wrong. It's cute. It's not, I mean, it's not really not wrong. We do need to reimagine. I agree 100%. The reason the UK is spending 12% is because the government is nationalized what they're going to pay for drugs. They're offloading innovation's budget to other markets that'll pay for it. I don't even disagree with what you're saying about in emerging markets, we have to figure out other ways to do care delivery. That's for sure true.
Okay.
And I'm not even, this isn't uniquely about pharma. It isn't uniquely about hospitals. It isn't uniquely about devices. The information transparency about all of them has got to come to light in a much different way. The UK makes pharma work because they bulk negotiate. Look at your profit margin in the UK versus the US or a variety of other, or Southeast Asia for that market.
Cole, I'm sorry, really, we're coming to the end of this session, and I would like just to ask very rapidly one question from the public before we wrap up. We will have really 2 minutes to answer actually quite a key question, given what we've heard about the importance of data. A question from the public goes, could the panelists give one key recommendation to accelerate the adoption of digital health and data in healthcare sector? If you had one key recommendation for that, who would go with that question?
I think I'll just have a very short answer, which is partnership with super apps in Southeast Asia. I think that could be one way to accelerate adoption of digital health, given that the super apps have already massive user base.
Thank you. Thank you very much, Ethan.
Do what Japan did in 2018 and financially make sure there's a payment and there's a tariff for telehealth, telemedicine, and digital services.
Thank you very much. We have 4 minutes to close the session. So if I may ask you all, really as a wrap up, if you had one last sentence, one key takeaway from this session, one message you would like to give to us today, what would it be? I would have to ask you to be really very short. Who would like to start?
I'm happy to start. So given the title of the session, I'd say that the new health economy should consist of not only the traditional healthcare players, but we should look beyond healthcare to find solutions from organizations like tech and others who can help solve and think differently about the problems that face us in health.
Thank you, Tony. Great. Who feels like? Amit?
I can go. At the end of the day, we are pretty clear that we are never going to run short of patients, especially in this part of the world. So let's find ways of how do we pay for it. So rationalizing the payment structure probably is the most important thing in the next couple of years.
Thank you. Thank you very much.
Right. For me, I think opportunities will continue to arise for innovative and virtual care health tech players to actually own more of the value chain in the continuum of care of patients and more integrated care approaches. That's my takeaway.
Thank you. Wonderful. Thank you, Ethan. Harry?
Yeah, I would say just to one of the quotes like is I would say the future's already here. It's just not evenly distributed. And I think there's more that governments can do and society can do to make sure that we actually distribute the innovation and the best practice that we see across the region and beyond to really meet the healthcare challenges that we see today.
Thank you. Thank you very much. So Cole, one last word.
Yeah, so 2 words, data transparency. This will solve all of the ills, data transparency. The more we push out data transparency across the entire system, the more the system will self-correct and rationalize.
Okay, wonderful. Thank you so much. Thank you, everybody, really, for what was a very interesting discussion. Thank you, everybody, for being here. And well, have a nice day. This session is now closed. Thank you. Goodbye. Bye-bye.
Thank you, Helena. Bye, everyone.
Thank you. Bye, everybody.
Bye.